By what name are you known?
There are some who call me Tim.
Get him. Get him.
Hi, this is Amanda.
And Jessi.
We're the See You Next Tuesday podcast.
That's right. Podcast that covers crimes against family members.
And you're listening to 2010 Minutes with the functioning psychopath, Tim.
Timtendo 64, episode 64 of 2010 Minutes, a podcast that focuses on mental health through humor, insight, and personal stories. That introduction was by See You Next Tuesday podcast. What an anagram. True crimes and the family members that commit them. Hosted by Amanda and Jessi. Awesome duo. Great girls. But they leave you on a high note with this podcast, all right? If you're a big fan of this podcast, you know that I don't ever do introductions by true crime podcasts because I'm not big into them. And I feel like talking about people dying on a mental health podcast, kind of weird. But every person listens to a true crime podcast. I have asked everybody. They love it. And I get it, like the whole like stories and death, they're fascinating. So they're the first ones of a true crime podcast to introduce. So that opens up the floodgates. I made them first because they bought a t-shirt of mine. So that's how you get on my show. First, 1-800-273-8255, National Suicide Prevention Lifeline. Or you can text the crisis text line. Text the word home to 741-741 if you're in the US or Canada. Or if you need more information, if you're out of the North Americas, go to crisistextline.org. But yeah, go to 2010minutes.com to get all your merch needs and help a brother out. I have a phone number now you can contact, 781-523-9333. I set up one of those like Google phone things so people can text me direct if you want to. And you can download the 2010 Minutes app to contact me as well and listen to all my episodes. Today's topic, I was having troubles thinking of what I wanted to do because I waited last minute yet again, and it's driving me nuts. I'm going away to New Hampshire this weekend to go skiing, which I'm not skiing. I'm not a skier, but I need to get it done before Tuesday, so that will be good. Today, I am doing an episode on my medication. I think it's kind of cool because I don't really talk about medication. A lot of people don't talk about medication. But if you listen to the Waffle Shop podcast with me and Taylor James, not James Taylor, Taylor James, we talked about that and he commended me for being one of the few people, if not the only person, to bring up the actual medication that I do take. So I do want to dive into that a little bit. And as you can see, if you're watching on YouTube, which you should follow me on YouTube, youtube.com/2010minutes. But here are all my meds. I am showing the camera 5 medications that I take pretty much on the reg. Well, 4.5. I'll explain that in a minute. A lot of these medications have withdrawal symptoms, or if you take them, they might give you seizures. When I was a kid, I had febrile seizures. They're convulsions that can happen when a young child has a fever above 100.4. Febrile means feverish. Can last a few minutes and they can stop on their own. So I think that's why I'm a great dancer, because I had a seizure as a young kid and I invented the Harlem Shake before everyone else did. So I'm going to do a quick rundown of what medications I take and what they do and how they affect me, which is kind of hard to judge. I'm on Wellbutrin, 75 milligrams. I'm on Adderall XR, 50 milligrams. I take 25 milligrams a day. I'm on Lamictal. I take 200 milligrams one time a day, which used to be twice. Actually, no, I take 200 milligrams twice a day, resulting in 400 milligrams. Holy shit. I take hydroxyzine when needed, 25 milligrams. And then I have another one. I don't know the name, but it's for cold sores. It's Oclaver. And you know what? Let's break the stigma on cold sores, all right? Or fever blisters, if you want to say that, to make yourself feel better. Everyone thinks it's like terrible, which it is. Like you pass it along pretty easily. If sharing is caring and caring is cool. No, if sharing is caring and sharing is cool, then why don't we call cold sores cool sores? You know what I'm saying? there's genital herpes, and then there's cold sores on your mouth. It's like simplex 1, simplex 2. Pretty much a lot of fucking people have the cold sores. I used to get them when I was stressed out like crazy. I rarely get them now that I take medication. I'm like kind of relaxed, even though you don't think I'm relaxed. But yeah, I have medication for it. Zap that mother out. Cold sores are so embarrassing when you're out there. I get them on the side of my lip and I like hide it so I talk like Popeye. So if it's on the side where I already tuck my lip in, it's a lot easier. But let's dive into this. Something I had to Google was some of these medications have like a name, but then they have a different name, like a different brand, almost like a different brand cereal. And I looked that up. Why do some drugs have different names? Every drug has an approved generic or medical name, decided on by an expert committee. Another committee I want to be on. Yes. Many drugs are also known by a brand or trade name chosen by the pharmaceutical company. Oh, look at that. Making and selling that drug as a medicine. If several companies make the drug, it will have several different brand names. Generic and brand names must be unique to prevent one drug being mistaken for another when they're prescribed, which is a wicked smart guy. So there's no confusion. And the FDA must agree to every proposed brand name. It's definitely like someone puts their hands in a Scrabble bag and they're like, here is a new drug. You can put them any direction that you want. See how many points you get. If you play Scrabble and you're stuck and you have a Q and an I, you can play that. That's a real word, and I don't know what it means, but it counts. I don't know if someone loses points if they call you out and they're wrong. But let's dive in to Tim's medication within 20 minutes. Hopefully this isn't a two-part episode, but if it is, you'll realize by the title of the show. So let's start off with bupropion. Bupropion. Again, that is one that I can't even pronounce. But the good thing is that stands for nothing because I take Wellbutrin. That is the name. So that's probably the other companies that make it. I like how it has the word well in it because it's an antidepressant and it's a smoking cessation aid, which helps people who smoke not smoke. I never smoked. I never wanted to smoke. I kind of like the smell of secondhand smoke, but I don't like the smell of it on somebody. You ever make out with somebody that smokes? Oh, that is foul. But I always heard it stunted your growth, and I think I'm due for a growth spurt soon, so I don't want to ever smoke. It can treat depression and help quit smoking. It also prevents depression caused by seasonal affective disorder, which I covered before, which is an acronym. Oh, is it acronym or anagram? Oh, shit. I think I said anagram with the See You Next Tuesday podcast. I am not a smart man, and it's okay. This is me. I'm a real person. I'm not a like prescriber. I'm not a medical doctor or anything. So when you listen to this episode, this is just me trying to learn and teach myself, which I don't know how to pronounce words. I don't know what words mean. I stutter, talk fast, and I'm out of breath, and I can barely make eye contact with the camera. So let's keep going with that. So what's funny is the milligrams they give me. I've been so fucked up for so long that it's funny to see the transitions of everything. So the recommended dose is do not take more than 150 milligrams as a single dose. I was on 75 milligrams. I talked to my prescriber yesterday when I was at work, told him what's going on. I cried outside of work while I was on the phone. And I tried to swallow it. And one of my coworkers came by outside and I was just like, turned my head, put my hood on. I was like, all right, man, see you soon. So he recommended me to go from 75 milligrams to the maximum of 150 milligrams. Your boy is going to be maxed out. So that's going to be fun. That's one of those ones you have to take every day and don't take prior to bed because I feel like the Wellbutrin does help a little bit, but I definitely need a little bit more, I feel like, because it doesn't last as long. But the thing with my medications too is they're all mixed together. So I don't know what does exactly what unless I take it by itself. So I could be wrong with some of these, but I did take notes, went to WebMD, which I probably shouldn't have because anybody that feels sick goes to WebMD. You put in your like symptoms. And it's like, yeah, you have AIDS. You're like, fuck, I'm going to die tomorrow. Then you go to the doctor and you tell them that you're on WebMD and they get so mad. Do you ever tell your doctor you went on WebMD? They do not get happy because I've been there multiple times. So I'm going to go over side effects with all of these. nausea, vomiting, dry mouth, headaches, constipation, increased sweating, joint aches, sore throat, blurred vision, strange taste in the mouth. I do get that. Diarrhea, and dizziness may occur. I don't really have much of those. I think the dry mouth, definitely diarrhea. Let's talk about poop. It's gonna be a poop episode. No sore throat or anything, but I like how some of these give you dry mouth because it makes you drink more water. But I'm a big coffee guy, so I need to substitute that out. But yeah, if you take alcohol or marijuana, it can make you feel dizzy or affect your coordination. Do not drive or use machinery, which I think a lot of people know this. When they say heavy machinery, they think of like cars, but it means like forklifts and stuff. I know, wait, they think it means like forklifts and like those like bobcats, but it actually just means cars. So obviously alcohol also can increase the risk of seizures, which a lot of these meds like withdrawal or symptoms can cause seizures. Obviously my seizures weren't as normal as the other ones, which it was just my fever. So I'm not really susceptible. I said that word right, to seizures. And luckily I haven't had any seizures. But yeah, it's like talk to your doctor if you're a user of cannabis, which is marijuana or the devil's lettuce. I found this interesting. For women that take this, the drug passes into breast milk and may have an undesirable effect on the nursing infant. That's crazy to me. It can affect a woman's body. Like that's why these meds scare the shit out of me. It like changes your mind, your body, and just like everything else. So it is kind of scary, and you gotta like balance it out and work out on these things. It's I don't know. So withdrawal from this drug, Wellbutrin, because it's an anti-depression discontinuation syndrome, which is basically a fancy way of saying antidepressant withdrawal. And I did pretty good at saying that too. This is common with antidepressants that affect the neurotransmitter called serotonin. Wellbutrin does not have a major effect on serotonin. As a result, the withdrawal symptoms are typically mild or often undetectable, which is great to know. And again, recommended dose is 150 milligrams. I take 75. Holy shit, because I'm going to 150. So I will definitely check in with you each week how that's going. So the next one is amphetamine and dextroamphetamine, which is Adderall XR. The difference between regular Adderall and Adderall XR is one is instant and one is long lasting throughout the day. So if you're watching this on YouTube, I like to show the little meds what I got. And this is Wellbutrin, a little orange pill. And Adderall is a little capsule that looks pretty cute. It looks like a Dr. Mario piece that you have to line up. So those have beads. So I have to take those because it lasts all day for me because it's so tough to just take it as needed. And I did at first, but I feel like I told him, and I didn't even know this existed, the Adderall XR. So I do and don't like it. So listen to this one. The most you can take in a single day is 60 milligrams at most. I've been climbing the ladder. I'm not at max, but I'm 10 away from max, and I take 50 milligrams a day or up to 50 milligrams a day. So a little bit more about this is the combination medication, because it's two little things of the amphetamines and the dextroamphetamines. It says treat ADHD, which is attention deficit hyperactivity disorder, which we all know that I have. It works by changing the amounts of certain natural substances in the brain. I'm always like out of shape. I'm going to the gym, I think, today to get back in shape. Your boy wants to get shredded for the summer. So it's a class of drugs known as stimulants. It can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may help you organize your task and improve listening skills. That hasn't been happening to me, and I think I talked to him about that, and he says to keep on it. So I guess I just got to keep riding that train to see how it goes, but I've just been so unmotivated, and he says the Wellbutrin should help that. Hence, he like maxed it out. I've been super lazy starting things again with this podcast. I feel so bad for myself and you, the listener, that I haven't been keeping up with it on like social media and all that stuff. And it bums me out. So that's like spiraling at a different degree where I fuck up and I just pile it on that like I'm just a piece of shit and I'm not good enough, which happens a lot from my day to day. So taking this medication afternoon may cause trouble sleeping. That's a new one for me because sometimes I wake up a little bit too late and I don't know if I should take it. So sometimes, not all the times, I only do one pill because I have to take 2 pills a day, 2 of these bad Larrys at the same time because they don't have just one pill that has all that stuff. Side effects, loss of appetite, which is a big one for a lot of people. People that take Adderall are usually on the smaller side. Not everybody, but I always notice that because your appetite is low, which happens to me a lot. So I do have to force myself to eat even when I'm not. Dry mouth, which is good. Stomach upset pains, nausea, vomiting doesn't happen. Dizziness, headache don't happen. Also another diarrhea issue. So this is making a lot of sense. I need to get a bidet sponsorship. So go out and get a bidet. Nervousness, yep. And trouble sleeping may occur, yep. And obviously, always tell your doctor if these side effects are bad with any medication, including more problems, signs of blood flow problems in your fingers or toes. Doesn't happen. Unusual wounds found on fingers or toes. Nope. But mental health behavior changes happen to me, such as agitation, aggression, mood swings, depression, abnormal thoughts, and thoughts of suicide. Check all those off. Then you got uncontrolled movements, continuously chewing, teeth grinding, which I've been doing lately, outbursts of words and sounds, pressured speech, baby. Listen to last week's episode if you want to know more about that. Change in sexual ability, desires. I kind of don't want to go down the sexual route, but I think one day I will. Some days I'll just let you know I'm fucking frustrated, and you can put 2 and 2 together. And then frequent prolonged erections. That's all right. The medication may increase serotonin and really cause a very serious condition called serotonin syndrome toxicity. What is that? What is that, you ask? Serotonin syndrome is when your body has too much of a chemical called serotonin, and it usually because of the medication of combinations of the medications. Yeah, I guess I might have a little bit of that. I still don't know what serotonin means, and I should have fucking Googled that. So someone text me and let me know and break it down like I'm 5 years old. Withdrawals aren't too bad, but you have similar side effects, so it's actually not that bad for going down off it. The thing with Adderall, it's addicting to a lot of people, and you always have those kind of friends that like, hey man, can I just get one of your Adderalls? Because I think you can make meth with it. The good thing, I don't know if that's true, so it tells you that I don't do meth. But yeah, be careful with Adderall if you're on it, and obviously don't share it. My next one, which is a big one, Lemotrogen. And I can say that right because I've been taking it for a while, which is called Lamictal with my name. Oh no, mine's called Lemotrogen, and it's a general for Lamictal. Again, I take 200 milligrams twice a day, and I'm maxed out. Lemotrogen is used alone and with other medications to prevent and control seizures. So like these things balance each other out. It's like, yeah, you might have seizures on this one, but this one counteracts. So my body's just fighting with itself and be like, we got to make this work. Oh, this kid's going to kill himself. So thanks, guys. I appreciate it. Here. I'm an idiot. It may also be used to help prevent the extreme mood swings of bipolar disorder in adults. Here's your boy. Side effects include dizziness, drowsiness, headache, vomiting, and upset stomach may occur. My toilet bowl is getting abused. And if they get worse, then call your doctor or whatever. Remember that this medication has been prescribed because if your doctor has judged that the benefit to you is greater than the risk of the side effects, which is great. I remember when I first got on this, they were a little bit worried. So I'm glad it's been working. I think that's a huge one for me. And that one, again, I want to talk about like how these affect me. When I take these like in the morning, I feel really positive. Sometimes I'm not motivated still, but then I can feel it decrease over time. So I do have to figure out what time to take it and make sure to take it at that time every time. Taking medications sounds easy, but it's not, especially for me. And I need to be better, but I've talked about that way too much. And the same thing with weed and heavy machinery with this. Don't use it. But I don't want to say like I do that stuff, but I kind of do some of that stuff. Only some of that stuff, not all that stuff. And again, with this drug, this drug passes into the breast milk and may have undesirable effects on the nursing infant. Same thing as Wellbutrin. It's like if you take both of those, like, so is any women out there that have that problem that you take that and heard of that? It also, the medication may decrease the effectiveness of hormonal birth controls products. This can affect the resultant pregnancy. And there's a lot of withdrawals, which I probably should have zoomed in on, but there's anxiety, possible seizures if you withdraw on this, and just bad symptoms, risk of psychosis. So yeah, I have to take this every day. And the old one that I was on before this, I don't remember the name because I never cared to remember the names. So those ones I took before the Lamictal, which is a little blue pill. It's not the same. So when I was having really bad withdrawals from it, I didn't know. And I told my therapist about it, and they were like, Tim, you have to take that every day. I'm like, oh, my bad. I've missed like every 4 days or maybe a week or maybe my second dosage. And they were like, you got to be better with that. And I felt scolded. Not like it was like I'm not mad. I'm just disappointed. And so I've been a lot better on that. But yeah, I just confused the two. And I was like, oh yeah, I can miss one dose or two. I'll be fine. And your boy was not fine. Before I get into the last ones, because these ones aren't really huge. Again, like the one with the cold sores, pink little pill. That thing zaps it out. I get lysine helps as well. And then putting like alcohol in it to kill. But do not be smooching people and do not be performing oral sex on people. Okay, this is a direct message from Tim McCarthy. If you have a cold sore, you stay in your house and don't even look at anybody. Just get that thing fixed. And don't share straws, drinks, any of that. Don't share life if you have a cold sore or cool sores. They're called cool sores now. But I talked this earlier with the See You Next Tuesday podcast. And I don't want to say which girl it was because I don't really want to not expose them, but she was very open about her anxiety and everything on her podcast, which is good. Like they're a very positive, people dying oriented true crime podcast. And I always forget about it is always worse. Like my best could be someone's worst and my worst could be someone's best. And there's things I forget about or don't even know about. And we were talking about insurance companies with medication and how some of them can be super difficult. Mine is pretty good. I've never had a problem besides a bill that was wrong. And I'm glad I said something because I was like, this is way too much. But she's having issues with that and what she's been going through. So it is unfortunate that happened. So I don't even know how to correct that. Maybe like just hammering it away at them or just annoying them or just having your doctor just annoy them. But that is unfortunate, and that probably happens to a lot of people. I'm fortunate enough to have great health insurance because of my job, and I shouldn't take that for granted because it's just one of those things. It's like out of sight, out of mind, and I don't know the other side of that. So hopefully that gets fixed for her. And I salute you hanging in there. It's not easy because it is stressful calling, especially for me when I have to call somewhere. I need to take my extra anxiety meds, which is a great segue because here's my anxiety meds. I take these as needed. It was like Ativan. I was on Ativan for a little bit, and then I was on Xanax, and I had some issues with Xanax where I would take it and like call my buddy Duff, like crying with like music in the background. And he would call me the next day. He's like, you all right? I'm like, yeah, why? He's like, dude, you called me yesterday, like crying on the phone. I was like, I did? Don't abuse drugs, kid. So I am on hydroxyzine, which you can take as recommended for yourself. Not recommended. Use it as you want. So I only take it so much because it makes me kind of drowsy. I can't even find the pills. It's a little white pill, which is great. I take only 25 milligrams of this, and I do it when it's in case of emergency because I kind of been using my anxiety as a positive where I harness it and just like let it just out. And I don't care that I'm anxious. And I feel like that's weird, and maybe people don't think I have anxiety, but I do. My palms get sweaty, mom's spaghetti. I stutter a lot. I talk fast. Just a lot of those things. But I always think about this. I'm like, this will be funny later because the other person is probably so confused or they know I'm anxious. So I do love that. Hydroxyzine is used to treat itching caused by allergies. I got good skin. It is an antihistamine and works by blocking a certain natural substance called histamine that your body makes during an allergic reaction. So why is this anxiety? Hydroxyzine may also be used for short term to treat anxiety or to help you feel sleepy, relaxed, and before and after surgery. I don't take it that much because it makes me sleepy, and I'd rather be awake and anxious than calm and sleepy because I do sleep much. I didn't know what an antihistamine is, so I looked it up. They're drugs which treat allergic rhinitis, common cold, influenza, which is the flu, and other allergies. Hydroxyzine is also used to treat the itching or whatever. It is an antihistamine. I'm just reading the same fucking thing I wrote down. I don't know why I wrote that twice. So you can just disregard that, rewind 15 seconds, and fast forward 15 seconds. You can take, it's between 400 milligrams and 600 milligrams as the max dose. I take about 25. Side effects: drowsiness, dizziness, blurred vision, constipation, dry mouth. My mouth is so fucking dry with all these that I need to chug water every minute. Things that can help that, though, for the dry mouth, you can suck sugarless hard candy. One time I worked at CVS and this old woman came up, and they weren't Werther's, but she got nips, and they were called they were like the second rate. It was like the generic name for it, for butterscotch or whatever. She's like, "Oh, I just love sucking on my nips," and I was like, I don't know if you're saying that on purpose or what, but lady, you're scaring us. Ice chips, chew sugarless gum, drink water, or use saliva substitute, which I don't know what that is. What is saliva substitute? I will try it on air and see if it works. I do apologize if I sound like shit. We are closing down, so I'm going to hurry this up a little bit. Some anxiety medications like benzos, Xanax, can be habit forming and can lead to dependence, which I got off at. So it starts to, the body starts to need it to functioning. And this one doesn't have any withdrawal symptoms, so it's good. There's no benefit, there's no negative for getting off it. I'm sorry I sped through all this. I wanted to make sure I went over my medication. Maybe I'll tackle a little bit more next week. So I do appreciate you guys listening. Hopefully you learned a little bit. Again, I'm going to talk a little bit more about this next week. But my movie suggestion, I was taking a nap on the couch last night, Airheads, with Brendan Fraser, Steve Buscemi, and Adam Sandler. Great movie. Go watch that. Music suggestion, I never really got into him, but I've been getting into him now. Prince. He has a banger called My Name is Prince. Great one to start off with when you go down the Prince hole. My name is Prince, and I am funky. I love you guys so much, and have a good one. And we're clear. This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. If you are feeling suicidal, please dial 911.